Alright, so I've gathered my appropriate equipment. I'm going to go in and walk into the patient room, do hand hygiene as I walk in, provide patient privacy. And throughout the assessment, I'm going to note a few different things such as her hearing, her hygiene, and her eye contact, different things like that. So, hi, my name's Lance. I'm going to be your nurse. I'm going to be doing your head and neck physical assessment. So I'm going to start with your head, move to your eyes, your ears, your nose, your throat, and then down to your neck. So can you start by telling me your name?
Alexa.
Do you know where you are, Alexa?
The hospital.
Do you know why you're here?
For a checkup.
And do you know what time it is?
About 8 o'clock.
Awesome. Okay. So first I'm going to, she's oriented ×4 and she's alert. So I'm going to go ahead and move and I'm going to look at her facial symmetry. Her face is symmetrical. I'm going to move to her head. I'm going to palpate and assess her cranium and her hair and her scalp here. I'm going to look for any physical deformities. So I'm going to palpate and try to feel any deformities. There's nothing noted. So she has no physical deformities. And so then I'm going to palpate her temporal artery. And then I'm going to move to her temporomandibular joint. If you will open and close your mouth for me a couple times. Okay, thank you. And I'm going to assess your maxillary and your frontal sinuses. Okay, so now I'm going to go ahead and assess her head. I'm going to move to her eyes. Do you wear any glasses or contacts? No? Okay. So I'm going to shine a bright light here and look at her sclera, her iris, her pupil, her conjunctiva. There's no paleness or jaundice noted. If you will, I'm going to go ahead and assess Perla, okay? Bright light here. Just look right at me. I'm going to look at her left eye and back at her right eye. And then I'm going to shine this in her right eye and look at her right and look at her left, okay? Now, if you'll look at this and then look at the wall and back at this. Perla is present. Her pupils were dilated 2 millimeters in diameter, and her Perla is present, so it's round, equal, and reactive to light. And now I'm going to go ahead and do the confrontation test, okay? So if you will, tell me when you can see my fingers.
No.
And from here?
No.
And from here?
No.
Good, okay. This is where we could go ahead and do the Snellen chart. We'd have a Snellen chart set up, have her walk 20 feet away. She would cover one eye and then the other, and we would have her read the lowest line possible with each eye, and that way she could we could see what her vision was for each eye. Now I'm going to go ahead and do the 6 cardinal gazes. So if you will, just follow my finger. And then follow my finger in. Good. Okay. So now we're going to go ahead and move to your ears. Look for any skin breakdown, any lesions, any drainage. There's nothing noted on the outside. So I'm going to look at her ear inside at the tympanic membrane in her canal. There's no drainage or inflammation noted. Her eyes are symmetrical, her ears are symmetrical, so I'm going to go ahead and do the whisper test. So I'm going to come behind you and I'm going to block one ear and repeat after me what I say. Apple.
Apple.
Good. And from this side?
Baseball.
Good. Okay. Now I'm going to go ahead and move to your nose, okay? Can you go ahead and occlude one side and try to breathe through it and then do the other side? And we're going to check for patency here. Now I'm going to go ahead and look in her nose for any skin breakdown, and I'm going to look at her septum, her turbinates, and her mucosa. Okay. And then now I'm going to get this off, and we're going to go ahead and move down to your mouth, okay? So if you will open up for me, I'm going to look at her tongue, I'm going to look at her gums, her teeth. Can you say ah?
Ah.
There's her uvula is in good condition, it's mobile. There's no skin breakdown, any lesions in her mouth. If you will, pull your tongue up, look at the palate, look at her floor of her mouth. Teeth are in good repair. She has no halitosis. Looked at her buccal membrane, or her buccal mucosa, sorry. We looked at her buccal mucosa. It was in good condition. Everything looked good in your mouth. So now I'm going to go ahead and move from your mouth down to your neck. So I'm going to look, I'm looking for any jugular vein distension, any masses, or any pulsations. I don't see any masses or anything, so I'm going to go ahead and palpate. So we're going to start with her carotid artery. I'm going to feel her carotid artery. Now I'm going to go ahead and move, I'm going to palpate her lymph nodes. So we're going to start with her pre-auricular lymph node on each side here. Posterior auricular, occipital. Okay, and now I'm going to move down. Sorry, I'm going to move down to your submandibular. You can go ahead. Submandibular, and your tonsillar, and your submental. Okay. Do you mind? Can you go ahead and stick your tongue out for me and assess your cranial nerve 12? Good. Okay. And say ah again for your cranial nerve 9 and 10. Good. Okay. So now assess your lymph nodes. I'm going to go ahead and assess the ones on your chest. Okay. So I'm going to look at your supraclavicular, which is right above your clavicle, and then your infraclavicular. If you'll turn your head for me, I'm going to try to feel your deep lymph node in your neck. No hardness. Alright, now I'm going to go ahead and move to your trachea, okay? Assess and palpate your trachea. Now I'm going to come behind you and I'm going to assess and palpate your thyroid. And, if you will, try to swallow for me. Okay. Alright. Can you move your head side to side? And can you try to touch your shoulder with your head without moving your shoulders? And can you move your head back? Can you pull your shoulders up? Good. She has full active range of motion, and she has adequate muscle strength. So, I'm going to go ahead and check your tonsils. I think that's the only thing I did forget, okay? So if you will open your mouth. Tonsils are not inflamed. They're grade 1. Okay. And that is all for the assessment. So I'm done. Throughout the assessment, I did note that she has no hearing loss. She maintains constant eye contact. Her speech is clear and spontaneous. She has good posture. She sits up. She's comfortable with her posture. Her mood is calm and cooperative. Her affect matches her mood. She has good personal hygiene. Her clothing matches the seasons, and she was in good overall condition of her health. So, and that's it. Thank you.